got pressure points, either tennis ball or just direct pressure. When I'm working with my patients, sometimes I would use my elbow and just apply pressure to trigger points that they would have. And it hurts like a son of a gun, but it's one of the best treatments in terms of getting rid of that. So that's kind of a little takeaway that you can use for yourselves, and your parents will love you for it if you take care of their stress nodes. So a lot of that, and I also did a lot of work with balance and what we call the vestibular system. Does anybody know what the vestibular system is?
Isn't it in your inner ear?
Yeah, absolutely. It is absolutely your inner ear. Have any of you had a concussion? A couple of you? Okay. And we're hearing a lot more about concussion, aren't we, than we ever did. All sports teams, do you guys all have to go through a concussion screen if you're doing sports, especially football players or contact sports? No? No? What's that?
This is AP Bio.
Nobody's in hard sports here. But you know what though? I mean, even there are some schools who, for any sport, will make kids go through a baseline concussion screen. And one of the problems with concussions is that inner ear, that vestibular system, gets knocked off. And that's one of the most fascinating parts of my job when I was working with patients, because the inner ear, and there's two parts to it. The inner ear on the outer part has crystals in it that help us know where we're at, all right, so our orientation. And then the vestibular part of our brain helps determine how we move. It takes the information coming in from our bodies. So how do we know? When I go to sit down, right, I'm not going to look at this chair, but I know where it's at, right? And I know when I should expect to hit the chair. Has anybody ever gone to sit down in a chair and it was either lower than you thought, and you kind of jump a little bit and feel a little bit silly, right? And then you sit down, or you miss a step. Have you ever done that? You go to take a step, you're expecting one more step and it's not there, right? So you kind of stumble a little bit. So we've all done that. And why do we do that? Because the brain is expecting one thing, and what happens is not what we expected, right? And so we kind of stumble and correct ourselves. The part of the brain that does that is our inner ear, okay? The other thing that we do is we use vision to tell us where we're going. So if I was to walk around this classroom with my eyes closed, it would look very different, wouldn't it, than if my eyes were open. Once I know where everything's at, then I'm fine. But if I expect to go here and I'm walking over and somebody kindly puts a chair in front of me, that's not going to look pretty. So we use all of our senses all the time to move and do what we need to do. And when something goes wrong, that's when we've got to figure out, okay, what's not working like it should be. So when I would work with my balance patients, what I'm looking at is, okay, is the part of their body working like it should? So sometimes patients have had hip replacements and they've never really got the strength back in their hip, okay? I drive my husband nuts because I watch people walking. I can't switch it off. Everywhere we go, I'm analyzing people's gait. You know, and I was at a restaurant the other day and somebody's walking like this. And I'm like, oh, they've got a weak hip. He's like, stop looking at people's walking. Just leave them alone. But you know, what you learn as a PT, you learn to analyze people's movement all the time. And usually there are patterns, because if I've got a weak hip here, I don't have the strength to keep my body upright. So I compensate for that by moving my trunk over. And when I see people walking, that tells me that something is going on in their hip. And so that's what we do with patients, is we watch them when they come in and see, okay, what doesn't look right, and what are the reasons that could be. Okay, the other thing that people will do with a weak hip is they'll walk like that. And that tells me that they don't have the muscle strength in their hip to hold it when they're walking. So these are the things we learn and then apply when we're working with patients. For my balance patients, my biggest goal for those patients is to stop them from falling. All right, have any of you had grandparents who've fallen and broken something, ended up in the hospital? All right, it's not good news for old people to fall. It's not good news for any of us. For us, it doesn't do a great deal. We fall, we get back up, and we're fine most of the time. But when people get older, their bones are more brittle, their reflexes are not as quick, their muscles don't recover as fast, and so for them, it can be a huge deal when they fall. So that's one of the most rewarding things that I do working in my role as a physical therapist, is working with people for balance. Because if we can make a difference to how many people fall, that can make a huge difference to their lives. That can be in the difference between them staying in their homes or being in a nursing home. All right, do you think it makes a difference to your quality of life, whether you're in a nursing home or in your own home? Absolutely. Do you think the ability to move makes a difference to people's quality of life? Mm-hmm. Huge difference. You know, if I can't get out of my own chair and I have to wait for somebody else to help me get out of a chair, can you imagine how awful that would be? I need to go to the bathroom, but I can't. I can't get to the toilet unless somebody helps me get there. Right? And for people that means that they may end up going to the bathroom in their chair because they can't hold it. Right? So for quality of life, the ability to help people maintain movement is hugely rewarding. Hugely rewarding. And like I said, I've been doing this for 21 years and I love it every bit as much today as I did the day that I graduated. So it makes a big difference in people's lives, and there's lots of different things you can do with your career as a physical therapist. So a lot of people work in hospitals, in acute care wards, helping people after surgeries, after they've been sick in the hospital. What we do is we go in and get them up and get them moving as soon as possible, because staying in bed is one of the worst things that those patients can do. Okay, so we want to get them up and going. So a lot of PTs work in hospitals. A lot of PTs work in private clinics. They open their own clinics, and they are their own boss. Or they'll work in a private clinic, or they'll open it and own their own clinic. So you can do that with it if it's something, owning your own business is something that you want to do. A lot of physical therapists end up, well, not a lot, but some end up with sports teams as athletic trainers and physical therapists in charge of, the Lions, the Red Wings, whoever. There's a lot of PTs that work with sports teams. Some therapists will work in home care and or the school systems. Do you have a PT or an OT that comes into the schools? Yeah. Okay. And there's some people that work with a PT and the OT, or the speech and language therapist coming into the schools. So that's another thing that people can do with the career. For my career, what I specialized in was ergonomics. So I did a lot of treatment of all kinds of different things. And then I went on to be an ergonomic specialist. So what that means is I go out to different companies and evaluate different jobs. So I look at, say for example, an office worker who's having neck pain or shoulder pain. So I go and I look at where their desk is and where their chair is and how that's all set up. And the part that's interesting is looking at what's going on in the body as they're doing their work. Okay? And what is it about that work environment that's causing them to have the problem that they're having? Is it sustained posture? Alright, is it staying in one position for a long period of time? I'm going to have you guys do an exercise just to wake you up. It's hard to stay focused for a long time. I want everybody to take their arms out like this. Make sure you don't hit your neighbor. Too hard. Just go for it. And just hold them there. Alright, just hold them out for a little while. Okay, keep them up while we're talking. You're going to feel what static work feels like. Okay? So what we look at is static work and what that does to the body. Because you guys know from your Krebs cycle and from your biology work, what's the byproduct of a muscle reaction? Lactic acid. Have any of you, the first day you run or do a sport, how do you feel the next day? And you can barely move your muscles, right? That is lactic acid. Lactic acid sets off an inflammatory response. So we get inflammation around that area. Okay. How are the arms feeling? Are they getting a little heavy for some?
Oh, yeah.
Yeah. Is it easier if you move them? Is that easier? Or harder?
It's a lot of work.
So it's a lot of work, right? For some more than others, right? Some are going to be able to hold it longer than others. But can everybody feel a little bit in their arms beginning to get a little bit sore? Or that you wouldn't really want to hold them here all day? Now, if you change position, it's better. But just holding them statically for long periods of time is pretty rough on the muscles. Okay, you can let them down. And here's why. What happens there is when you move a muscle, you create lactic acid, right? You're working that muscle. Every second that you are working that muscle, this is static work, you're still working it because gravity is acting on it, right? So you're working it against gravity. If I stop working it, that happens, okay? So every minute you're working it, you're creating lactic acid. If I'm moving my muscles, then what's happening is we're getting a squeezing effect of the muscles, and we're squeezing out that lactic acid. We're moving it away and into the bloodstream. But when we work statically, you're working the muscle, but there's no movement. So there's nowhere for that lactic acid to go, so it builds up. Now, when you run or you do a sport for the first time in a long time, what happens there is you work the muscle much harder than it's accustomed to. So you're creating like micro tears within the muscle. And that's how muscles get stronger. Okay, so when we work muscles, when we're strengthening people's muscles, the muscles have certain functions to do. Who can tell me what muscles do? If we think about the muscles around the knee and the ankle, why are those important? They support, right. What do they support? Ligaments and joints. Exactly. They're the dynamic support, okay? The ligaments are what we call the passive or non-dynamic support. So the ligaments, if you think about the ankle joint, the ligaments go on all around it and give it what we call passive support. They don't move, they're just holding it to stop it from moving. And then the muscles provide the dynamic support. All right, so the way I talk to patients about muscles is imagine like a hammock. Imagine your joint is you, okay? Has anyone ever jumped into a brand new hammock and it's really cushy and you kind of jump and it's really comfortable? It gives. Anybody ever sat in a hammock that's really comfortable? Mm-hmm. All right. Now imagine jumping into a hammock that's been left out and it's all wore out and overstretched and it's kind of solid. It's going to feel very different, isn't it, if you jump into that hammock versus jumping into a nice, cushy, springy, brand new hammock. And that's how muscles work, right? So if you've got really weak muscles, the joints have got no cushion to them. The joints are moving on each other and there's no cushion. But if you strengthen up your muscles, then they've got a lot of cushion for the joints. Okay, so you've got a lot of movement that your joint can do safely. All right. The other thing that the muscles do, and when we do rehab for ankles and knees in particular, because sprained ankles and sprained knees are very, very common. Very common. There are little things around the ankles and knees called proprioceptors. All right, it's a big word, but what that is little nerve endings that tell us what's going on, that tell the brain what's going on. So if I go with my foot and I step on the edge of a curve and my ankle starts to roll like this, okay, to the side, there's little nerve endings in those ankle ligaments and muscles that start to tell my brain, we're approaching the end of our movement here, you better do something, because if you don't do something, we're going to tear. Right? So, now, are they actually saying that? No. It happens that fast. So, and when we've all done that, you go to go there, and you either fall, or you pick up your foot, you shift your weight, you do something, and the brain knows within a second, a millisecond normally, that's going on. So that's how fast those nerve impulses. It's absolutely fascinating. And the more I learn about it, the more just amazed I am at how intricately the human body works. So, but what happens when our muscles aren't strong enough to bring it back? So the nerves are saying, do something, we're going to tear. If I don't have strong enough muscles on my ankles to pull it back or shift my weight, it's going to tear, or it's going to break, or I'm going to have that injury. So that's why strengthening muscles and balance work for knees and ankles are so important. And in rehab, you'll see we do lots of single leg work, standing on one leg, bending your knee. Let's all try that, because I think you all need to stand up. It's hard to stay focused, I know that. All right, so try standing on one leg, and then just do little knee dips on the one leg. Just see how your balance is.
Caleb's not.
And if it's not good, if you can't do this, I strongly suggest that you work on it. Now, the other thing that we teach patients to do is do the same thing with your eyes closed. Close your eyes. All right, a little different, isn't it, when you close your eyes? All right, now some are better than others, and that's normal. But that's a little test that you can do to check your own balance. And I move that. Now, the other thing that I'll do with patients is have them stand with their eyes closed, and this is a little tougher. And turn your head. All right, so try that. This is another little test to see how you do with one leg, eyes closed, and turn your head. A little tougher, isn't it, to do that? Okay, so that is just a quick little demo. You can have a seat again. That shows how we test patients and how, when we add more variables, it changes what's going on in the body. Okay, so. And I can do this because I do this with my patients all the time. And I tell my 80-year-old patients to do this. I have them stand in a corner of their home, an inside corner, so they don't fall over. And stand and balance, because that's one of the best things for keeping them healthy, keeping them safe. But for sports injuries, we do a ton of that as well, because we want for our athletes and our sports people to prevent injuries. And I think that was what your project was on, Morgan, wasn't it? And so what Morgan found with the strengthening program was that ankle injuries went from 5 to 0 with a strengthening and stretching program, okay? And the stretching helps to make sure that the muscles and the joints have the correct range of motion. So if I go to move and my ankle's really stiff, I'm not going to have the range of motion to be able to do all the things that I want to do. If I'm on uneven ground, if I'm walking on sand, or an uneven lawn, or I'm walking sideways along a hill, if you go down to the fireworks on 4th of July and you're sitting on the hill, right, and it's not even and you're walking on an angle, you better have good range of motion and good strength on your ankles to be able to do that. Because otherwise you're not going to be able to correct when you change your position, all right? So, and then the ankle injuries, I think you find the knees were the same. There was only one injury, okay? And you've all done the research methods, haven't you? You've all looked into how to do a research project and how to choose your dependent variables and your independent variables, and how to control so that you know that if there was an effect, it was because of what you did. Do you remember doing that? All right, that's important stuff. In my world and in what I do in physical therapy, and right now in particular, I'm doing several research studies. So that's very high on my attention list right now, because we're looking at critically ill patients, and when we do an intervention, and what we're looking at is there's a new product on the market that is a patient's bed that goes all the way up into a standing position. It's pretty cool. So they're in bed, but they can be in bed and you can stand them up. So we're looking at what does it make a difference with critically ill patients whether we do therapy once a day and just stand them up once a day, or whether we use this bed and stand them up 4 or 5 times a day. Do they get better more quickly if we stand them up more often? That could be huge for those patients that are very, very ill. If it makes a difference, that could have a very, very important clinical impact. But doing the research to make sure that we keep all the other variables the same in an intensive care unit is pretty challenging. So we use all the things that you're learning, we apply them on a daily basis to treatments, to research, to health and wellness. And what's exciting is it makes a big, big difference in patients' lives and in their families' lives. It is very, very rewarding career. So I went into ergonomics, and then about a year ago I started my own company. So I'm now a full-time consultant, which is where I've gone with my career, is I now consult all over the United States on helping people do research, on helping hospitals start programs for safety and ergonomics programs, and I teach people about physical therapy, I do webinars, and I do learning type activities. And I still do some treatments. I still work at the hospital maybe once or twice a month. Some months I don't do any, some months I do 4 or 5 days. But I love it because it's something else. I'm now my own boss, and I have my own company, and it's still doing physical therapy. So, for my opinion, it's a great career. If you like those kinds of things, there's a lot you can do with it. It is a lot of school. It's about 7 years of school to become a physical therapist. And in Michigan now, and in fact in most of the states now, if you go to become a PT, you end up with a doctorate in physical therapy. So you end up as a doctor of physical therapy. There's five schools in Michigan of PT, and they're all excellent schools. So that's kind of a ballpark of what I do. What questions do you have? Any?
What's the most common thing people come in for, like, see?
Back pain. That would be the number one diagnosis that would treat as back pain. Secondly, shoulders. So back pain is one, shoulders are number two. Lots and lots and lots of rotator cuff tendinitis or rotator cuff tears. And people will always call it their rotary cup. So it's, but it's the muscles in the shoulder that should keep the shoulder bone right down in its socket, but they don't work. They start to get weak, and so what happens is as the shoulder moves, that bone hits the bone on top and starts pinching. So that causes a lot of problems, and you'll see people kind of grimacing as they lift their arm up. Okay, so that's a good question. Yes?
Do you see more of like males or females, or is it pretty equal?
I'd say 50-50.
Yeah,
I'd say 50-50. And it's even in the athletes and the young people that across all diagnoses, I would say it's 50-50. Yep.
Okay, so sometimes, like, why do muscles give? Like, sometimes I'll be running in tennis or something, and my ankle will kind of just give. Like, it won't, like, it wouldn't have hurt before or, like, after, but it just kind of gives and I'll, like, fall or something and look stupid.
Right.
But, like,
Sometimes that can be a nerve that's, it can be the nerve that's not working quite right, like it's sending an erroneous message, if you like. And when we talk about nerves, I think of it like an electrical circuit, like a light that's shorting, right? So you've got a light that's kind of flickering and it's got a short wire to it. So the nervous system is like your electrical system. And so sometimes when people's ankles give or knees give, sometimes it's like just a nerve thing. But it can also be that proprioception piece that I was telling you about. How did you do with your balance with your eyes closed? Doing this?
With it closed, not well.
You struggle. And see, when that happens, when they suddenly give, from my experience, that's usually kind of a balance issue and a proprioception issue. So the ankle nerves knowing exactly where they're at and the muscles working in sync with them. So what I would recommend if that happens is practice eyes closed doing some of this stuff. Even eyes closed, moving other parts of your body to just balance on that leg. That may make a difference to it. Yep. So.
I hear a lot about strains and sprains, but what's the difference between the two?
Okay, good question. The difference really is between a ligament and a muscle. The official diagnosis, a sprain is a ligament, a strain is a muscle. And the way I always remembered it in school, and I'm giving away how old I am now, but we still had records. Do you remember the old records, right? Mm-hmm. And they were called LPs, right? Do you remember LPs? Are you sure the vinyl ones? And I always remembered LP. Ligament is a sprain, and a muscle is a strain. So that's really the only difference. But people use the terms together all the time. But good question. Anything else?
So I guess if you strain or sprain something, is there one that's worse than another?
A muscle tends to recover a little quicker than a ligament because it has a good blood supply. Ligaments do not have a good blood supply. If you ever look at cadavers or you look at ligaments, they're white. They don't have it. They get their nutrition from fluid around them. They do because they don't contract like a muscle do. That's good English, isn't it? They don't contract, so they don't need the same degree of oxygen as a muscle does, but they get their nutrition from the fluid all around it. A muscle tends to heal better because it has a rich blood supply, and the blood supply is what carries all the nutrients for healing. So if I were to choose, I would tear a muscle rather than strain a ligament. Yeah. Okay. Well, thank you guys. All right.